So now we're going to be talking about respiratory diseases that are common in children, pediatric trauma, child abuse and neglect, and then other special considerations. So croup, this is an infection in the swelling beneath the glottis, and the glottis, you guys can see it's right there, so you're going to see some swelling here. And I put a picture of a seal right there because that's the way that you're going to be able to know that it's croup, is that it's going to sound like a seal cough. So there's still going to be a low-grade fever, but I'll show you guys how that sounds like, unless, I mean, you guys all know how a seal sounds like, but we'll still watch this video.
Yes. Yeah.
Now, croup is another virus that we see, or it's caused by a virus. It causes inflammation of the upper airway. So like the vocal cord area gets really swollen. Then it causes a crazy sound. Usually when they breathe in, it's really noisy. That's called stridor. They can also have a horrible cough called the seal bar cough, is the kind of the classic description of the cough. Croup tends to be the worst in the middle of the night or from waking up from naps. Those are the two times that you see croup having the worst symptoms. Usually during the day they're fine, but nighttime rolls around and they're really sick again. So then we usually treat based on those symptoms to kind of help them get through the night. We will prescribe a steroid for some babies with croup, or do a different kind of breathing treatment with epinephrine in clinic to help treat the croup symptoms. If you're home and your baby is a little older and they're not in too much distress, you can use cold air. So you either have the freezer door open, if it's in a summer night, you can open the freezer and have it stand by the freezer for a little. That cold air can help. Or if it's in the middle of winter, you can stand outside with the baby and kind of bundle them up, and that really cold air can help to constrict those vocal cords down. The other thing we use is a hot, steamy shower. So turn the shower on as hot as it goes, close the door in the bathroom, and just stand in there. That hot air can really help as well. Croup is a very common thing that's usually nothing to worry about, but with that the sounds that you hear and that respiratory distress, we would say call right away. Try those quick maneuvers at home of the cold air or the hot, steamy shower. If they're not giving you any relief, come in.
Okay, so the treatment for a lot of these illnesses and diseases we're going to talk about, they're all going to be the same. So always remember that if the SpO2 is below 94%, we're going to give oxygen. Make sure that the patient is comfortable in a comfortable position. Don't force them to lay down or anything. With croup, like in the video said, just remember that cool air and steam is going to diminish the swelling. Epiglottitis is inflammation, infection of the epiglottis, which we talked about what that was here, but there's still a picture here if you want to visualize it. They're still going to have a fever, but it's going to be a lot higher than in croup. And if it's untreated, it can be very serious in a child. And remember that the epiglottis is going to be a lot more elevated in a child than an adult, so they're a lot more exposed to this infection. So signs and symptoms, you're going to see drooling, a lot of drooling with children with epiglottitis, high fever. They're going to have a lot of pain when they're swallowing, which makes sense, right, because the epiglottis moves whenever we swallow food, water. They're also going to have like a kind of like a hoarse voice. Kind of sounds like they're just having a sore throat. But the main signs here would be the drooling and high fever with epiglottitis. With croup, it was the seal, bark, cough, and then a low-grade fever. So again, we're looking for those signs that they're having respiratory distress, like tripod position. Inspiratory stridor, so what does that mean? We know what stridor means, but what does it mean by inspiratory stridor? Yeah, so when you breathe in, you're going to hear the stridor sounds. What about, what would be the other one? Expiratory stridor. So when you breathe out, you hear the high-pitched sound, yeah. And then again, the same treatment, make sure that they're getting oxygen if needed. Consider ALS backup because this is a serious condition. Even though it's not as common anymore, it's pretty rare, it can still happen. So asthma, there's going to be an increase in mucus production as well as constriction of the airways and the bronchioles. For asthma, they're going to have a tight cough, so they're not going to be producing as much mucus as if it was another issue. Wheezing, which you guys have heard how that sounds, chest tightness, shortness of breath. We all pretty much know someone that has asthma, right? Or does anyone here have asthma? Yeah. So questions to ask, probably the most important one would be like allergies or what triggers your asthma. Do you have an inhaler? That's really important. Make sure that whenever you are giving the inhaler, which is albuterol, we want to see that it is the patient's inhaler, that it's not expired. Also, before we give that, we're going to call the medical director to make sure that we are allowed to give albuterol to this patient. So bronchiolitis is different from bronchitis. So what do you guys think is the difference between those two, bronchitis and bronchiolitis?
Bronchiolitis is inflammation of bronchioles.
Of the bronchioles, yeah, and then bronchitis is inflammation of the bronchi. So with this, they're going to have a low-grade fever, a lot of like mucus production, and swelling of the bronchioles. So same treatment, make sure to give them oxygen, less than 94%. Monitor them, make sure that you're constantly keeping up with their vitals. So pneumonia is infection in the lungs. So sometimes if we don't treat bronchitis or bronchiolitis, it can develop into pneumonia. And so they're going to have a fever with pneumonia, chest tightness, sort of all these similar symptoms and signs. So it's really, as an EMT, really all you're doing with all of these is you're just pretty much treating the symptoms. You can't really make a diagnosis as well just because it's so hard to be able to decide which diseases it is just because they all have very similar signs. They're always going to have trouble breathing. You're going to hear crackles, wheezes, fluid in the lungs, fever, all of that. So again, the same treatment. So congenital heart disease. So there's different types of congenital heart disease, but like you see in this picture, what do you notice? Right here.
Oh, there's no wall.
Yeah, so there's no wall between the ventricles, and so there's going to be like a mixture of oxygenated and deoxygenated blood, and so this is present like a child's born with. It's a congenital disease, so this doesn't happen over time. Usually they're able to detect it during pregnancy, but most of the times they're not. So usually you'll see this being shown whenever the child gets older, but again, it depends. So we're going to watch a short video about that.
Congenital heart conditions. A congenital heart condition is a problem with the structure of the heart, which develops before a baby is born. The most common congenital conditions include a hole between two of the heart's chambers, septal defects, narrowing of the body's main artery, coarctation of the aorta, narrowing of the pulmonary valve stenosis. These affect almost 1 in 100 births in the UK. In most cases, a problem has occurred during the early development of the fetus. This could be due to a mistake in a gene, but in most cases, there's no known cause.
Most defects can be detected during pregnancy, but some are not found until a baby is born. Less serious conditions may not be spotted until much later. Symptoms in babies or toddlers can include a blue tinge to the skin, poor feeding, breathing problems, extreme tiredness, rapid heartbeat, excessive sweating, and chest pain. Treatment depends on the individual and the condition. Some only require regular medical checkups, but others may need medication or surgery. There is evidence that some congenital heart conditions can run in families. The BHF is funding research about this.
Okay, so for shock, we know that sometimes it can be caused by like dehydration, loss of fluids, blood loss. So hypoperfusion, what does this mean? Yeah, so insufficient blood. All right, so with a child, you're going to see delayed capillary refill, the usual pale and clammy skin, decreased urination, and absence of tears. So you're going to want to ask the mother if they've noticed that if the child produces tears or if they're not, if they're changing their diapers more often or less often. You're really going to want to ask these questions just to make sure that the baby isn't dehydrated. Because what did we say about infants? Why is dehydration so common, or why can it be common? It has to do with the
Because of
skin.
the larger skin surface.
Yeah, larger skin surface. Yeah. And then how do we treat for shock?
Oxygen.
Keep them down. Well,
Oxygen
not,
and-
oxygen, keep them warm.
Keep them warm. Yeah.
Like
How would you give oxygen to an infant?
with
Free
the blow,
free flow.
Yeah, free flow, blow by technique. Yeah. Okay, so for cardiac arrest, we already talked about this, but shock could also lead to cardiac arrest. So know the ratios and all of that. We talked about this. Remember the child pads in an AED kit. Make sure you use those. They're usually there's usually like a pediatric AED sometimes, especially if you're in like an elementary school or something. But just remember that those you do have those. What if you don't have a child pads? Can you use the adult one?
I actually don't know.
Just like you put one.
Yeah, so you put one in the front, one in the back of the adult pads.
Oh.
So for seizures, what causes seizures? Besides all of this, but why do these issues cause seizures?
Well, it's a rapid misfiring of neurons.
Yeah, rapid misfiring of neurons. There's a issue with the electrical system in the brain, and so a lot of the times we're going to be seeing something called the febrile seizure. So you'll see this a lot in infants. If the child is having really high fever, then sometimes they can have a seizure. So just keep this in mind if mother calls in and she's worried and that her infant is having a seizure and he's a fine healthy baby. Make sure to ask if the infant had a fever or if they're having a fever. So make sure you take the temperature. That way you can make this prognosis. Remember that with seizures, you're going to see it's like different stages. Or there's like an aura stage. You guys remember that where it's where they start hearing things, seeing things, and then there's what was the other one? Tonic.
Yeah.
Tonic. So that's like muscle rigidity, and then after that's going to be clonic, which is the twitching that you see in seizures. What usually happens after the seizure? with a patient? What, like, let's say that they become conscious and they're aware, or they wake up from the seizure. What usually is like their first reaction?
It's like-
They can't, they're so stirring it, right?
Yeah, so usually they'll defecate in their pants. You'll see urination. There's a lot of confusion, so just keep that in mind. That's normal. So we just want to treat for, the cyanosis. Sometimes you're going to see that during the seizure they weren't having enough perfusion, excessive salivation or foaming of the mouth. And then status epilepticus. It's going to be a seizure lasting more than 5 minutes or recurring seizures without a recovery period. So just know this term. So remember that whenever you're, let's say you're seeing a person like actively seize, we don't really, we kind of just have to let the seizure go by, right? But what we do want to do is protect the airway as much as we can. Make sure to move everything that's around the patient. That way they don't get hurt. We don't want to restrain the person while they're seizing. We don't want to put anything in their mouths, right? Because we don't want to get our fingers chopped off or things getting stuck in their airway if we decide to put like a tongue suppressor or anything like that. There's like a myth that if a person's going through a seizure, sometimes they can swallow their tongue, but that doesn't happen. And again, with seizures, prepare to suction. Sometimes they may vomit or there can be excessive salivation. So we want to keep that airway clean. That's our main priority here. So for drowning, has anyone heard of the dry drownings?
Yeah.
Yeah. So it's pretty much like after the occurrence of a child that's drowning, later on they experience the signs and symptoms of like active drowning. So you're going to see poor gas exchange and the usual decrease in oxygen perfusion. Make sure that you gather as much evidence or as much information about when it occurred, how long were they submerged in water, were they listen to the lungs, make sure that if you do hear any fluid, you take note of that. And again, the same treatment, oxygen, provide ventilations if necessary if they stop breathing. So for fever, so what's a normal body temperature when you take a fever?
97.1.
Yeah, 97.1 to like 98, right?
Yeah.
Once you start getting to like 99 to like 101, that's going to be kind of like a lowish grade fever. But 104 to 105 is very concerning. So this is whenever we start seeing those seizures in small infants. So we want to make sure that whenever a child is having a fever, how do you want to like cool them down? Do you just like put ice packs all over them or anything? No, right? You really want to do it gradually over time. This is more for the comfort of the child too. So yeah, remove excessive layers of clothing. If they were exposed to heat, we want to cool the patient slowly. We don't just want to throw them in an ice bath or anything. We want to do it gradually. Meningitis, so the inflammation of the meninges, so lining of the brain. So with this, you'll see this a lot more common in children or younger people. This is why we usually get the meningitis vaccine before you go to college. And so you're going to see the obvious signs like high fever, vomiting. There's really a lot going on here. Our brain is really important, so you'll see a lot of symptoms everywhere. For an infant, you may see fontanelle bulging, which you guys remember, right, what that means. It just means that there's a lot of intracranial pressure. You also want to ask if they had a recent ear infection or any respiratory tract infection, because sometimes this can lead to meningitis. Okay, so this is contagious, so make sure that you're wearing a mask, gloves, a gown if you have it. Don't worry if you don't, but just make sure that you're protecting yourself because that's your priority, right? And treat for shock. So for poisoning, so children are really curious, especially infants. They're always putting things in their mouth, so you'll see this a lot more common in like younger toddlers. It's pretty surprising. Like 4 years of age account for 46% of